6 came forward, 2 were chosen, and at the end of the selection process, 1 will be the official administrator of the Turks and Caicos Islands National Health Insurance Plan, a 5-year arrangement with the Turks and Caicos Islands government that will determine how beneficiaries or residents of the TCI profit and receive proper and sufficient health care to counteract the hustle and burden of transporting residents to the United States for medical treatment. That is what members of the TCI healthcare industry discussed during the public presentation of proposals from bidders. The first of 2 offers came from Redbridge, a management consultancy and reinsurance facility which specializes in global health plan operations.
But the long-term plan for the Turks and Caicos is for TCI to administer its own health care plan, and therefore our role would be a very interim role for 5 years to help develop this health care plan, initiate it, transfer expertise to the Turks and Caicos Islands, and eventually turn that over for the long-term management to the Turks and Caicos Islands. That's our mission, and we are going to take that mission very seriously. That's what we do for a living.
According to the Redbridge team, their plan offers the TCI government proficient members that will train TCI professionals to take on the NHIP at the end of the 5-year contract. It begins with the construction of the 2 new hospitals, and it ends with the reinsurance that all residents will be able to afford proper health care locally and receive top offers from hospitals in the United States for emergency situations.
First is the benefit design, what's covered, what's not covered, how much is covered, how much the patient is going to pay. Oftentimes we find that the benefit design drives the kinds of healthcare services that are provided, and we want to make sure that the services that are provided are in fact necessary. Secondly, managing that 70% involves managing the costs of care here in the Turks and Caicos Islands and the cost of treatment abroad, and particularly costs of care in the United States. There are opportunities here to take advantage of some of the best cost-saving techniques that are available to manage the costs of care in the United States. And
taking in factors such as population growth into consideration was a major focus point for presenters.
If you think that the NHIP is about giving the people of Turks and Caicos the medical care that they need, well, health plan management is about making sure that they need the care that they are getting. And that's what we do. We see it in 3 phases. Everything you do before, which is the planning phase of it, and that involves enrollment, the billing and the collection, setting up the network, putting together disease management and wellness programs. The second phase are the 3 middle blocks, which is when the person is actually receiving medical care. And the first part, when you do the authorization, is making sure that the medical necessity and making sure that the person is in fact eligible.
Redbridge operates out of the South Florida base area and has managed other insurance plans throughout the Caribbean.